Please take a moment to read the indication and select important safety information, including the box warning on serious infusion-related reactions and neurotoxicity. Also, refer to the additional important safety information at the end of the video. Hello, I'm Rita Sokola, Executive Director and Associate Chief Nursing Officer at Children's Hospital Los Angeles. I am a certified pediatric oncology nurse with 40 years experience. In this video, I'll address the treatment course for DANYELZA and how to administer it. DANYELZA offers the flexibility of administration in either the outpatient or inpatient setting at the discretion of the treating physician, offering the possibility for the patient to return home after their infusion. In fact, in the clinical trials that led to approval, more than 90% of infusions were administered in outpatient settings. DANYELZA is administered as an intravenous infusion after dilution in combination with GM-CSF, which is given subcutaneously. This timeline shows you when GM-CSF and DANYELZA are given within each 28-day cycle. In each cycle, GM-CSF administration begins 5 days before the first DANYELZA infusion and is dosed at 250 micrograms per meter squared per day. On days 1 through 5 of each cycle, GM-CSF is continued daily, but its dose is increased to 500 micrograms per meter squared per day. So in total, GM-CSF will be administered for 10 days during each cycle. Be sure to administer GM-CSF at least 1 hour before DANYELZA, which is infused on days 1, 3, and 5 at 3 milligrams per kilogram per day. Refer to the GM-CSF prescribing information for additional recommended dosing information. For the very first infusion of DANYELZA, Cycle 1, Day 1, DANYELZA is administered over 60 minutes. Thereafter, infusions take 30 to 60 minutes as tolerated. After each DANYELZA infusion, patients should be closely observed for at least 2 hours in a setting where cardiopulmonary resuscitation, medication, and equipment are available. If a DANYELZA dose is missed, administer the missed dose by day 10 of the following week. In this case, administer GM-CSF 500 micrograms per meter squared per day on the first day of the DANYELZA infusion, and on the day before and the day of the second and third infusions, for a total of 5 days with GM-CSF 500 micrograms per meter squared per day. The recommended treatment course of DANYELZA plus GM-CSF is to continue 28-day cycles until the patient achieves a complete response or partial response. Following that response, the 28-day cycle is repeated for 5 more cycles. At that point, at the physician's discretion, treatment may switch to 8-week cycles. DANYELZA may be discontinued at any point for disease progression or unacceptable toxicity. DANYELZA with GM-CSF treatment involves pre-medication and supportive medication. For potential pain, a 12-day course of gabapentin or another prophylactic medication for neuropathic pain is initiated 5 days before the first DANYELZA infusion in each cycle. This is the same day that GM-CSF is initiated. 60 to 45 minutes before each infusion, oral opioids are administered, and additional IV opioids may be given during the infusion if breakthrough pain occurs. Finally, ketamine may be considered for pain that is not adequately controlled by opioids. To reduce the risk of infusion-related reactions and nausea or vomiting, IV corticosteroids are administered 120 to 30 minutes before the first DANYELZA infusion. They may also be given with subsequent infusions if a severe reaction occurred with the previous infusion or during the previous cycle. In addition, an antihistamine, an H2 antagonist, acetaminophen, and an antiemetic are administered 30 minutes before each infusion. For more details about the management of adverse reactions, please refer to the DANYELZA full prescribing information. As I mentioned, patients should be monitored during and for at least 2 hours after the infusion. Monitor closely for infusion-related reactions, which may include hypotension, bronchospasm, hypoxia, and stridor. In Study 201 initial analysis, onset was generally within 24 hours of infusion, most often within 30 minutes of initiating infusion, and most frequently during the first infusion of DANYELZA in each cycle. Serious infusion-related reactions may require urgent intervention, including fluid resuscitation, administration of bronchodilators and corticosteroids, intensive care unit admission, infusion rate reduction, or interruption of DANYELZA infusion. Blood pressure should be monitored during the DANYELZA infusion and daily on days 1 through 8 of each DANYELZA cycle. Patients should be evaluated for complications of hypertension. In the registrational trials, most hypertension events were observed on the day of DANYELZA infusion and occurred up to 9 days after the infusion. Patients should be monitored for symptoms of myocarditis, including chest pain, shortness of breath, or abnormal heart rhythms. Myocarditis has occurred in adolescent patients receiving DANYELZA in clinical trials and expanded access programs within days of receiving DANYELZA, requiring drug interruption. Patients should be monitored for orthostatic hypotension. In patients with symptoms, monitor postural blood pressure prior to initiating treatment with DANYELZA and as clinically indicated with subsequent dosing. Severe cases requiring hospitalization have occurred. Cases occurred within hours and up to 6 days of DANYELZA infusions in any cycle. Patients should be monitored for lab abnormalities, including cytopenia, changes in glucose, liver, and cardiac abnormalities. In clinical studies, the most common grade 3 or 4 laboratory abnormalities greater than or equal to 5% in either study were decreased lymphocytes, decreased neutrophils, decreased hemoglobin, decreased platelet count, decreased potassium, increased alanine aminotransferase, decreased glucose, decreased calcium, decreased albumin, decreased sodium, and decreased phosphate. Detailed information for managing adverse events and infusion-related reactions can be learned by watching Chapter 4 in this video series. In addition to information in this video series, downloadable resources are available on the DANYELZA HCP website. These include a preparation and administration guide, a billing and coding reference guide, and other clinical resources. These can be accessed at the URL shown here or by scanning the QR code. I hope you found this video informative. To learn more about DANYELZA, you can watch the other chapters in this video series and visit DANYELZAHCP.com. Now, please take a moment to view the indication and important safety information for DANYELZA. Thank you.
Indication. DANYELZA is indicated in combination with granulocyte macrophage colony stimulating factor, GM-CSF, for the treatment of pediatric patients 1 year of age and older and adult patients with relapsed or refractory high-risk neuroblastoma in the bone or bone marrow who have demonstrated a partial response, minor response, or stable disease to prior therapy. This indication is approved under accelerated approval based on overall response rate and duration of response. Continued approval for this indication may be contingent upon verification and description of clinical benefit in a confirmatory trial. Important safety information. Warning: serious infusion-related reactions and neurotoxicity. Serious infusion-related reactions. DANYELZA can cause serious infusion reactions, including cardiac arrest, anaphylaxis, hypotension, bronchospasm, and stridor. Infusion reactions of any grade occurred in 94 to 100% of patients. Severe infusion reactions occurred in 32 to 68%, and serious infusion reactions occurred in 4 to 18% of patients in DANYELZA clinical studies. Pre-medicate prior to each DANYELZA infusion as recommended, and monitor patients for at least 2 hours following completion of each infusion. Reduce the rate, interrupt infusion, or permanently discontinue DANYELZA based on severity. Neurotoxicity. DANYELZA can cause severe neurotoxicity, including severe neuropathic pain, transverse myelitis, and reversible posterior leukoencephalopathy syndrome, RPLS. Pain of any grade occurred in 94 to 100% of patients in DANYELZA clinical studies. Pre-medicate to treat neuropathic pain as recommended. Permanently discontinue DANYELZA based on the adverse reaction and severity. Contraindication. DANYELZA is contraindicated in patients with a history of severe hypersensitivity reaction to naxitamab-gqgk. Reactions have included anaphylaxis. Warnings and precautions. Serious infusion-related reactions. DANYELZA can cause serious infusion reactions, requiring urgent intervention including fluid resuscitation, administration of bronchodilators, and corticosteroids, intensive care unit admission, infusion rate reduction, or interruption of DANYELZA infusion. Infusion-related reactions included hypotension, bronchospasm, hypoxia, and stridor. Serious infusion-related reactions occurred in 4% of patients in Study 201 and in 18% of patients in Study 12-230. Infusion-related reactions of any grade occurred in 100% of patients in Study 201 and 94% of patients in Study 12-230. Hypotension of any grade occurred in 100% of patients in Study 201 and 89% of patients in Study 12-230. In Study 201, 68% of patients experienced grade 3 or 4 infusion reactions, and in Study 12-230, 32% of patients experienced grade 3 or 4 infusion reactions. Anaphylaxis occurred in 12% of patients, and 2 patients, 8%, permanently discontinued DANYELZA due to anaphylaxis in Study 201. 1 patient in Study 12-230, 1.4%, experienced a grade 4 cardiac arrest 1.5 hours following completion of DANYELZA infusion. In Study 201, infusion reactions generally occurred within 24 hours of completing a DANYELZA infusion, most often within 30 minutes of initiation. Infusion reactions were most frequent during the first infusion of DANYELZA in each cycle. 80% of patients required reduction in infusion rate, and 80% of patients had an infusion interrupted for at least 1 infusion-related reaction. Caution is advised in patients with pre-existing cardiac disease, as this may exacerbate the risk of severe hypotension. Pre-medicate with an antihistamine, acetaminophen, an H2 antagonist, and corticosteroid as recommended. Monitor patients closely for signs and symptoms of infusion reactions during and for at least 2 hours following completion of each DANYELZA infusion, in a setting where cardiopulmonary resuscitation medication and equipment are available. Reduce the rate, interrupt infusion, or permanently discontinue DANYELZA based on severity, and institute appropriate medical management as needed. Neurotoxicity. DANYELZA can cause severe neurotoxicity, including severe neuropathic pain, transverse myelitis, and reversible posterior leukoencephalopathy syndrome. Pain. Pain, including abdominal pain, bone pain, neck pain, and extremity pain, occurred in 100% of patients in Study 201 and 94% of patients in Study 12-230. Grade 3 pain occurred in 72% of patients in Study 201. 1 patient in Study 201, 4%, required interruption of an infusion due to pain. Pain typically began during the infusion of DANYELZA and lasted a median of less than 1 day in Study 201, range less than 1 day and up to 62 days. Pre-medicate with drugs that treat neuropathic pain, e.g. gabapentin, and oral opioids. Administer intravenous opioids as needed for breakthrough pain. Permanently discontinue DANYELZA based on severity. Transverse myelitis. Transverse myelitis has occurred with DANYELZA. Permanently discontinue DANYELZA in patients who develop transverse myelitis. Reverse posterior leukoencephalopathy syndrome, RPLS. Reversible posterior leukoencephalopathy syndrome, RPLS, also known as posterior reversible encephalopathy syndrome, or PRES, occurred in 2.8% patients in Study 12-230. Events occurred 2 and 7 days following completion of the first cycle of DANYELZA. Monitor blood pressure during and following DANYELZA infusion and assess for neurologic symptoms. Permanently discontinue DANYELZA in case of symptomatic RPLS. Peripheral neuropathy. Peripheral neuropathy, including peripheral sensory neuropathy, peripheral motor neuropathy, paresthesia, and neuralgia, occurred in 32% of patients in Study 201 and in 25% of patients in Study 12-230. Most signs and symptoms of neuropathy began on the day of the infusion, and neuropathy lasted a median of 5.5 days, range 0 to 22 days, in Study 201, and 0 days, range 0 to 22 days, in Study 12-230. Permanently discontinue DANYELZA based on severity. Neurological disorders of the eye. Neurological disorders of the eye, including unequal pupils, blurred vision, accommodation disorder, mydriasis, visual impairment, and photophobia occurred in 24% of patients in Study 201 and 19% of patients in Study 12-230. Neurological disorders of the eye lasted a median of 17 days, range 0 to 84 days, in Study 201, with 2 patients, 8%, experiencing an event that had not resolved at the time of data cutoff, and a median of 1 day range less than 1 day to 21 days in study 12-30. Permanently discontinued DANYELZA based on severity. Prolonged urinary retention. Urinary retention occurred in 1 patient, 4% in study 201, and in 3 patients, 4% in study 12-30. All events in both studies occurred on the day of an infusion of DANYELZA and lasted between 0 and 24 days. Permanently discontinued DANYELZA in patients with urinary retention that does not resolve following discontinuation of opioids. Myocarditis. Myocarditis has occurred in adolescent patients receiving DANYELZA in clinical trials and expanded access programs. Myocarditis occurred within days of receiving DANYELZA, requiring drug interruption. Monitor for signs and symptoms of myocarditis during treatment with DANYELZA. Withhold, reduce the dose, or permanently discontinue DANYELZA based on severity. Hypertension. Hypertension occurred in 44% of patients in study 201 and 28% of patients in study 12-30 who received DANYELZA. Grade 3 or 4 hypertension occurred in 4% of patients in study 201 and 7% of patients in study 12-30. 4 patients, 6% in study 12-30, permanently discontinued DANYELZA due to hypertension. In both studies, most events occurred on the day of DANYELZA infusion and occurred up to 9 days following an infusion of DANYELZA. Do not initiate DANYELZA in patients with uncontrolled hypertension. Monitor blood pressure during infusion and at least daily on days 1 to 8 of each cycle of DANYELZA, and evaluate for complications of hypertension, including RPLS. Interrupt DANYELZA infusion and resume at a reduced rate, or permanently discontinue DANYELZA based on the severity. Orthostatic hypotension. Orthostatic hypotension has occurred in patients receiving DANYELZA in clinical trials and expanded access programs. Severe orthostatic hypotension, including cases requiring hospitalization, have occurred. Cases occurred within hours to 6 days of DANYELZA infusions in any cycle. In patients with symptoms of orthostatic hypotension, monitor postural blood pressure prior to initiating treatment with DANYELZA and as clinically indicated with subsequent dosing. Withhold, reduce dose, or permanently discontinue DANYELZA based on severity. Embryo-fetal toxicity. Based on its mechanism of action, DANYELZA may cause fetal harm when administered to a pregnant woman. Advise females of reproductive potential, including pregnant women, of the potential risk to a fetus. Advise females of reproductive potential to use effective contraceptive during treatment with DANYELZA and for 2 months after the last dose. Adverse reactions. The most common adverse reactions in studies 201 and 12-30, greater than or equal to 25% in either study, were infusion-related reaction, pain, tachycardia, vomiting, cough, nausea, diarrhea, decreased appetite, hypertension, fatigue, erythema multiforme, peripheral neuropathy, urticaria, pyrexia, headache, injection site reaction, edema, anxiety, localized edema, and irritability. The most common grade 3 or 4 laboratory abnormalities, greater than or equal to 5% in either study, were decreased lymphocytes, decreased neutrophils, decreased hemoglobin, decreased platelet count, decreased potassium, increased alanine aminotransferase, decreased glucose, decreased calcium, decreased albumin, decreased sodium, and decreased phosphate.